I really invoke upon Black students, Black people in general, is to be patient with yourself and be patient with your non-Black peers. Just because they want to have a conversation doesn't mean that you need to engage in that conversation.
Dr. Nicole Fischer of the University of Virginia's Counseling and Psychological Services acknowledges the current pressures placed on Black students by an increased attention to the Black Lives Matter movement and outlines how to combat discomfort.
Non-Black peers, counterparts, classmates, professors, neighbors, whomever, reaching out to you that doesn't feel comfortable, that doesn't feel safe, that doesn't feel genuine, and may in fact be fulfilling a need on the part of the other person, as opposed to really being what you as the Black individual needing. I think that is because of increased awareness and conversation and media coverage of things. But I think this is the time where social isolation is probably the most dangerous or compromising situation that anyone can be in, because connecting with others is what is most important.
And how does this climate compare to the events or the aftermath of the events of August 11th and 12th a couple years back?
I think the students who were actually in Charlottesville felt most impacted by those events, as opposed to, when students were dispersed at their respective homes. And then coming back to grounds, I experienced a combination of students who felt kind of disconnected with what had happened just a few weeks prior to the start of the semester, and those who felt incredibly triggered returning to grounds or having been in Charlottesville throughout the summer and continuing to be in Charlottesville with their classmates and cohort members who weren't in town and experienced everything firsthand. Now, all of us are experiencing this wherever we are in the world, in fact. And so it's not isolated to Charlottesville or even being in Virginia, but every single person throughout the world is impacted by COVID. It's also impacted by the riots and, social uproar. I want to distinguish feeling distressed and bothered and overwhelmed and frustrated and sad and anxious with mental illness. Because we're all, Black people in particular, we're all feeling a lot of things right now, and we're all feeling them very strongly right now. It doesn't mean that all of us should be diagnosed with depression, anxiety, PTSD, etc. And so I think that sometimes the conversation kind of unintentionally gets mixed up. I never want people to think, because I'm talking to a therapist, it's because my situation is on a clinical level. There aren't a lot of Black and African American therapists at CAPS. And so that presents a challenge and just sort of an inherent discomfort for a lot of students to come to CAPS and to speak frankly on these issues.
While Dr. Fischer has not been treating as many students herself since going remote, she wants to emphasize positive mental health practices individuals can implement from home.
The three-pronged approach that I always encourage people to do is eating, sleeping, and engaging in social support. I encourage people to at least have those three aspects of their life in order, because everything else kind of comes out of that.